Welcome to Mid-City. Welcome to the General of Mid-City. I want to thank all of you for coming here today so we can share a little bit of what we're doing here today, along with a collaboration with the state government, the local government, and with the military. Each one of these hearts behind me represent a COVID patient who was treated and released from the Mid-City Hospital successfully. We have about 40 hearts. We hope that over the next several weeks we will have many more of these hearts. And I want all of you out there, clinicians, the community, physicians, military, state, local government, to know that each one of you has a little bit of a part of a heart in here with us. And without your help, we wouldn't have been able to do this. So thank you very much. And I'm going to introduce Governor Edwards now, who will have a few words of encouragement, thank yous for all of us, and perhaps a little bit of a briefing in terms of what he's expecting in the coming days. Thank you.
Thank you, Ricardo, and thank all of you for coming out this morning. It's a pleasure to be with you, although we all wish that we weren't here under these circumstances. And I want to thank all the people at Baton Rouge General, both at this facility and at the other campus, and for the work that you all have been doing for a long time. And the way that you quickly stood back up this hospital and expanded your capacity to take COVID patients, and doing it in cooperation with all the hospitals in this region really has been inspiring to me. It's made a tremendous difference. And Edgardo, there's no doubt that these hearts on this wall wouldn't be there but for the fact that you did this, and all of the wonderful healthcare professionals that you have here working, and they're working really across the region, across the state. And just like when I talk about numbers, and I'm going to do that again in a minute with the daily update, every one of these hearts represent one of our brothers and sisters. So this isn't just a heart on the wall. This isn't just a number. This is somebody's mother, somebody's father, or brother or sister, or aunt, uncle. So thank you for what you're doing here. Mayor Broom, thank you very much for your work and all the work that you're doing and your team's doing to serve East Baton Rouge Parish. I also want to thank Lieutenant General Laura Richardson for being here with us today, and all of the folks from the U.S. Navy who are here staffing these beds here at the Mid-City campus. Incredibly important to us and making a tremendous difference. Welcome to Louisiana, each and every one of you. As I said, I'm grateful for the team here at the Baton Rouge General. And if you look not just here in Baton Rouge, but across the state, across the country, and if you're looking for heroes today, they are our healthcare professionals. They are our nurses, our doctors, our respiratory therapists, everybody who is coming together to work so hard and so well to save lives and to improve lives. And you know, when we pray to God that we will provide comfort and peace to these COVID patients and healing to them, you know, He sends healthcare professionals. So it really is an answer to our prayer. And so we need to pray for those individuals too, that they will have the grace and the courage and the strength to be able to do what they're doing day after day and continue making that positive difference. And the support that we are getting from the Navy is absolutely invaluable, and we really, really appreciate it. And look, this is coming from a West Point graduate. It's hard for me to say. No, I'm joking. It's not hard for me to say at a time like this, but I will say beat Navy. I would also be remiss if I didn't thank the members of the Louisiana National Guard who are supporting our COVID response. 1,281 members that are working right now under the excellent leadership of General Keith Waddell and all the folks that he's got there working for him. Another 31 still doing recovery work from tornadoes last Sunday, Easter Sunday. And this is another reminder to everybody, we have forecasted a great likelihood, good chance of severe weather again this weekend, primarily in North Louisiana, but we should all be mindful of that for the rest of today. I want to go through the numbers today. I can report that at noon, when we update our numbers on cases and so forth, we're going to report 348 new cases in Louisiana. That'll bring us to a total of 23,928. Unfortunately, we will also report 29 new deaths, bringing us to a total of 1,296 deaths. Now, the number of cases and the number of deaths are lower than they have been for the last number of days. That's a good thing, but I would caution everybody that typically on Sunday the numbers go down. It's just a function of when the labs report and so forth. And so what we would like to see is a continued downward trajectory tomorrow and Tuesday and on through the week. I don't yet have the number, but over the last number of days, each day we've been reporting few, even though the number of cases is growing, the number of people in the hospital with COVID-19 has actually been on a slight decrease. The number of COVID patients in hospitals using mechanical ventilators has been decreasing slightly. Those are the most promising numbers, and remember that deaths are a lagging indicator. It takes about 11 days for some, on average, for someone, a patient, to succumb to COVID-19 once the symptoms appear. And a lot of times the deaths that we're reporting today actually happen not just in the last 24 hours, but in, going back several days. But obviously we grieve every time that we report a death. I guess what I'm saying is it still appears that we're trending in a good direction. And that's a good thing, because if you'd have been paying attention a month ago when we were reporting the fastest case growth anywhere in the world with the Johns Hopkins data, we are in a much, much better place today than we thought we were going to be. And it's because of the citizens of Louisiana taking the stay-at-home order seriously, making sure that they're social distancing and they don't go out in public more often than they need to. And when they do, and they're going to be in close proximity to people, they're going to wear a mask just like everyone here today. And then the personal hygiene remains critically important as well. One of the greatest things that I've seen, not just today, but since we've been engaged in this COVID fight, is this wall behind me and those hearts. And Edgardo told us what they represent, and I'm very, very thankful. And I hope that there will be many more hearts on that wall before this is over, and I believe that there will be. This is obviously a difficult illness. Too many people have lost their lives, but most people do recover. But they're recovering because of the great work that's being done by our healthcare professionals. This city, the Mid-City campus here reopened for the purpose of increasing our medical capacity in response to COVID-19. While the campus was closed, it was well maintained, as you can see, with much of the equipment still in place to make it easy to reopen. There are inpatient hospital beds, ICU beds, and just the work that they've done here to so quickly stand back up an excellent hospital has just been tremendous. The hospital opened just a couple of weeks ago to help us meet the medical demand here in Baton Rouge, and has capacity to expand with yet additional beds if necessary. And sometimes it's not the beds that are the hard part, it's the staffing. And that's why having the Navy personnel here is so critically important to what we're doing. And we are forever grateful for that. As always, I want to remind everyone that it's going to take all of us working together and for some period of time to defeat this virus, get back to life as normal. We're not going to see that for a while. I suspect we won't fully see it until after there's a vaccine that has been administered to the entire population. We can do more to get back to normal between now and then, and we will. But we're going to have facilities like this. We're going to have even more robust testing than we've had in the past. And the testing has to be followed up very quickly with contact tracing for those people who test positive. We're working on that right now in cooperation with the federal government, with our local partners. And as tough as it's been, I am very heartened, very gratified to tell you that we've had more testing in Louisiana on a per capita basis than any other state in the nation. And that has helped us to turn the spread around and to do better. So I want to thank all of you again for coming out this morning. It is my pleasant chore right now to introduce the mayor, president of East Baton Rouge, Mayor Sharon Western Broom. So thank you for being here. Thank you for your leadership. And I look forward to continue working with you, Mayor. God bless you.
Thank you, Governor Edwards, for all that you've done to lead our state through this. I am so pleased to see the work here at Baton Rouge General Mid-City and to see all of the healthcare professionals who are here and how the military, the Navy, is here providing us with much needed assistance. You know, I've always talked about the importance of partnerships and collaboration, and that's never been more true than right now in this pandemic. Our healthcare providers are partnering with our local, state, and federal government in this fight against COVID-19. The residents of East Baton Rouge Parish deserve united leadership during this pandemic, and what you are seeing right here is exactly that, united leadership. So I want to thank all of our residents for all that they have done to slow down the spread of this virus by staying at home. And that is the new hashtag, stay at home until further notice. You know, these are indeed anxious times. As the governor and as Edgardo has stated, we have lost many of our own people. Today, as we think about the Sabbath day and Sunday, let us remember them in our prayers, and we will, moving forward, address the inequities that have been laid bare during this crisis as well. But the good news, as you heard the governor say, we are making progress in the state and specifically here in East Baton Rouge Parish. There is light at the end of the tunnel. Our community will recover and our economy will rebound because as leaders, we are making that our top priority. Thankfully, we have a good team in this community and throughout our country. We have leaders like Lieutenant General Laura Richardson, the commander of the United States Army North. From being a helicopter commander to now the leader of the military's ground war against the coronavirus, I'm glad to see this effort in such capable hands. Lieutenant General, we welcome you to Baton Rouge, and we thank you and your medical team for the badly needed assistance they're providing here at the Baton Rouge General Mid-City. Welcome, General Richardson.
Well, thank you, Mayor Broom and Governor Edwards. It's my privilege to be here, absolutely, in the great state of Louisiana, and the support that we're providing to the Baton Rouge General Hospital here. And just amazing support, being able to come into the facility. The staff here is just like a family. And our Navy personnel couldn't be in better hands, quite honestly. It's just a pleasure to be able to provide the federal support from the Title X active duty side of the House and be in support of the Adjutant General and the Governor and the Mayor in this effort to fight this pandemic war. We have a total of about 8,000 of our active duty and U.S. Army reservists that are out on the front lines as well, augmenting right now about 8 different states across the nation. This is just absolutely unprecedented, the type of support that we're providing, because normally it's in support of hurricanes or floods or earthquakes, and it impacts maybe at the most 6 different states, not the entire country, is what we're seeing with the coronavirus. So absolutely want to provide that support and the much needed capabilities with our medical professionals. I am so proud of the medical professionals, the doctors, the nurses, the respiratory therapists, the medics. It is just tremendous to see them. And I get to go and visit them and see them on the front lines and see the support that they're providing patients and the much needed support. I think it's a good news story about a lot of the folks that are recovering from coronavirus. And that is that's the untold story. So absolutely the support is very much needed. But thank you so much for your time today. Thank you for the just absolutely warm welcome in Louisiana, and have a great day. Thank you.
And I would like to open the floor now for questions from the media, if any.
knew that was going to be too easy.
I'm sure it's not for me. So.
Questions for the governor. You talked about how this is especially difficult because states can't help other states. We're all kind of in the same boat here. Explain then the importance of having federal help, including the Army and the Navy.
Yeah, so we're accustomed to natural disasters in Louisiana because we get way more than our fair share. And every time we get one of those, typically it's a flood, it's a tornado, more often a hurricane. And there may be another state or two that are impacted by that, but clearly not a big part of the country. What makes this public health emergency so differently is that we need exactly the same things as every other state in the nation and about 160 countries around the world. And so those resources are in short supply. And so we can't just put out a request and know that our sister states are going to respond to that request as they typically do, or that the federal government can look at Louisiana and focus entirely on our state the way that they have done in the past. So that makes every bit of help that you do ultimately get that much more important and more needed. And so having General Richardson here today, having all of the folks with the military come to Louisiana and help us here in Baton Rouge and in New Orleans is incredibly important to us. And look, they've helped in many other ways. I'm talking about the federal government with respect to PPE and ventilators and beds and so forth. But just having that help means an awful lot. And it's going to help us get through this. And there's going to come a time, so long as we can keep in check the cases until such time as there is a vaccine and effective therapeutic treatments, then we're going to have a certain level of capacity to deal with COVID. But also, what we've been seeing in our hospitals is our non-COVID patients really haven't been coming to the hospital for a number of reasons. One is we stopped all of the non-emergency medical and surgical procedures. And quite frankly, a lot of people out there are saying now is not a good time for me to go to the hospital to seek treatment. Well, that can only continue for so long. And those non-COVID patients are going to have to come back to our hospitals and our clinics, and we're going to facilitate that sooner rather than later. But when that happens, it makes it that much more important that you have facilities like this one that can continue to take and give excellent care to the COVID patient population out there. We can't do it without the military. So it's very, very helpful to have them here. We really, really appreciate all of the work that they're doing. And as someone who served in the military myself, I have always appreciated the professionalism, the willingness to serve and to sacrifice, because all of these people have homes and families elsewhere. But they're here in Baton Rouge helping us take care of our people, and we really appreciate it. On behalf of the state of Louisiana, we really, really appreciate them being here. Any other questions?
I don't know if either y'all can take this, but could you just say what the role is every day for these active duty members, what they're doing here?
So what we have today is a complement of nurses and medics. You got to think of medics as an EMT / LPN type model, and they're in essence operating one of our 30-bed units. In the next few days, we will expand that to an additional 30-bed unit and to the intensive care unit. And the beauty of the model is that, in essence, they take over a whole unit with some help from our personnel and some initial training with the electronic health record and so forth. And the guidance of our physicians that are already here in Baton Rouge, that is what allows that to happen. And the beauty of the system, too, is that we have a ready flow of patients from the other hospitals, Our Lady of Lake Oshner, a little bit from Women's Hospital, and also from the Bourbonnais Hospital at the General. So those referral relationships and the flow of patients is already there, and that's why they're so busy here at Mid-City. Other questions?
One for the general.
Yes.
You mentioned you called it a pandemic war. Can you compare what
this
this is
general.
like? Yes. Can you compare what this war is like to wars in the traditional sense and how the response is comparable?
Well, I think it's very comparable. But we don't normally think of our doctors and nurses and respiratory therapists and medics having to be on the front lines, right? And so that's what's happening with this particular one. And the gear that we wear, much like if we were in a chemical or biological environment, we have a suit, we have we have a mask, and we have booties, and we have all kinds of what we call kit, right, to protect yourself. So that's the PPE in this particular case. And so it's actually very, very similar to everything that we train for.
All right, well, thank you again to the media, thank you to all the clinicians and physicians in the back, thank you to the Navy and the Army, thank you, Governor, for your support, thank you, Mayor, for your support of the city. And there's a light at the end of the tunnel, and there's hope, and for the next few weeks, we're going to start thinking about how to take care of those who delayed their care for a little bit. And so this next phase is going to be a difficult phase, but we're ready for the challenge. And all of us at the General, all the other hospitals in the area are ready and willing to go to the next phase. So thank you again for your support. Appreciate it.
Thank you very much.